The TROPHY study was a large single-arm phase 2 study that enrolled patients with metastatic urothelial cancer who had progressed despite prior treatment with chemotherapy and immune checkpoint blockade, and oftentimes with other therapies as well. And patients were treated with sacituzumab, govitecan, and antibody-drug conjugate. This is an antibody-drug conjugate that's been developed for a number of malignancies, with activity in a number of malignancies, including triple-negative breast cancer, now being studied in urothelial cancer. These patients have had prior treatment with platinum-based chemotherapy and immune checkpoint blockade, and potentially other treatment lines as well. So this is a relatively heavily pretreated population of patients. This study was a large single-arm phase 2 study. There's already been data from a prior study with sacituzumab in this patient population showing activity. In this larger study, confirmed that level of activity. There are clearly responses that some of which can be long-lasting with this drug. This is an antibody drug conjugate with a different target in a different payload than the other antibody drug conjugate that's approved in this disease, which is enfortumab vedotin. This class of drugs in multiple malignancies, urothelial cancer notwithstanding, have really demonstrated activity in patient populations where we haven't really seen this level of activity before. So lots of enthusiasm around this drug class. And I think what remains to be seen is how best to move these treatments earlier in the course of the disease, how best to combine these therapies with other drugs, and importantly, whether or not there is non-cross resistance between these antibody drug conjugates like enfortumab vedotin and sacituzumab govitecan.